I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 78. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about other issues as to why you may not be able to lose weight. And a lot of people come to me and say, well, Dr. Joe, I've done everything right. And I look at them, and most of them are lying to me, I'll be honest with you. But every now and then somebody really is doing it right, and they're stuck. So if that's the case, sometimes we need to jumpstart the weight loss protocol, which we can do. We talked about intermittent fasting. We talked about some other tricks we can do. But sometimes there's an issue. Like, for example, we started talking about the thyroid gland. And you can have a thyroid test, and absolutely you should. I agree 100%. We can do it in our office. We can send you out for blood work if we need to. We can do a lot of blood work in our office for hormones and thyroid and everything. But what I find is that sometimes the tests come back normal. And then we don't know what's going on, and the doctor says, well, the thyroid's fine, there's nothing wrong there. And I like that. I like the fact that it's normal, but many times it's because you don't have enough iodine in your diet. Now, what the heck is iodine? Well, iodine is, you probably remember it from when you were a kid, put it on your cuts. But iodine is what we make the thyroid hormones out of. So if you know anything about thyroid hormones, they're called T1, T2, T3, and T4. The number 1, 2, 3, or 4 is how many molecules of iodine are attached to that hormone. T1, T2, T3, and T4 is 1, 2, 3, and 4 molecules of iodine. But here's the catch. Most people, especially Caucasians, in Asia it's a little different. They eat more seaweed, Japan especially, but the further you are away from the shore in any country, the less iodine you have. And this is why we started putting iodine in salt. That's why it's called iodized salt. Because so many people are having thyroid problems, especially in the United States, in the Midwest, that the thyroid started to get bigger. It's called a goiter. And an organ, when it's malfunctioning, traditionally will get bigger to try to work harder. My father had a weak heart. He had a rheumatic fever as a child, and he didn't get the proper medical care that he needed. And the infection got into his heart muscles, and it affected his mitral valve. And so as an adult, he had to get a mitral valve replacement. And his heart, because it was so weak, was huge. Now, your heart is about the size of your fist, and if I take a chest x-ray on you, I'm going to see it on the x-ray. But my father's was probably 2 or 3 times that size. And it just got bigger because it was weaker to pump more blood. So the body is brilliant in what it does to try to survive. And so if your thyroid is getting bigger, what we do is, it's many times a lack of iodine. So if you're eating seaweed, how many people eat seaweed? Raise your hands. Probably not a lot of you. You're going to get a great source of iodine. Iodized salt might be just enough iodine to maybe prevent some goiters, but it's not enough for the thyroid to thrive. So when I was creating Dr. Joe's Super Greens and Dr. Joe's Essential Source, one of the things I wanted to make sure I put in there was iodine. So we add sea vegetables to both the Super Greens and the Essential Source to give you an excellent source of iodine. So a lot of folks will say, Doc, I started losing weight when I started taking Super Greens and Essential Source. Now, it could be a lot of things. It could be that they started getting the nutrients that they need, their metabolism increased, they weren't as hungry. But one of the things I believe happens, and I don't know how to test this, is that finally, for the first time in their life, they were getting adequate supplies of iodine. And the thyroid started working again. So it's another benefit to Super Greens and Essential Source because it does many things. And it's very inexpensive. It tastes great. There's no reason why you wouldn't be taking it. The only reason you haven't taken it yet is because you haven't gone to the website, drjoe.com, and ordered it. And if you don't want to pay shipping, if you're in the Atlanta area, come by our offices and pick it up. I have no problem with that. I don't have any desire to pay the post office more than I need to. So if you want to pick it up, we have offices in Marietta, Duluth, and Stockbridge. Also make an appointment while you're there, and we'll check out your nervous system, neck pain, back pain, shoulder pain, numbness. We'll check your digestive system. Yeah, let's cover that now. What the heck? Another reason, and we'll check your nutrition if you make an appointment at drjoe.com or at our offices. But this is something that affected me. When I was overweight, and I used to be really fat when I was a kid, I remember eating a lot of food, and my stomach would hurt, but I never felt full. Well, I didn't never feel full, but I'd still want to keep eating. Anybody have that aside from me? Yeah. You know you ate enough food, And you're still like, I still have these cravings. I still want something. I want some dessert. The problem is that I find the stomach is not working properly. Now, your stomach sits below a sheet of muscle called your diaphragm. And you have a hole in the diaphragm, and food drops in a hole, it closes, you digest food, and you pass it on. Chances are your stomach is pushed up into the diaphragm. And so you're not digesting your food properly. So what might be some symptoms you might have? How about acid reflux, heartburn, burping, gas, bloating, chronic cough, sinus problem? Acid is coming up into your esophagus. The danger of that is it can eat away at your esophagus and actually ultimately lead to things like esophageal cancer. So kind of could kill you. So what we do in that, instead of giving you medication to try to calm down the acid, because you need acid to break down your food, we actually adjust or pull the stomach down away from the diaphragm. And when we do that, we physically move it. It's not a big move, it's a couple of millimeters, but now it's finally below the diaphragm and you're able to digest your food properly. So the acid reflux many times gets better, you start digesting your food better, the gas and the bloating goes away. It's just crazy. When people get this done, they're like, they want to name their kids after us. They're like, oh my gosh, you guys are miracle workers. No, we just understand how the body works. But when I had that problem, I knew my stomach was out of place because I wanted to keep eating. And to this day, every now and then it happens, not very often, but I ate enough and I want to keep eating, I said, my stomach's out of place. The only logical explanation I have for this, and I've never seen research on this, it's just logic, is your stomach produces a hormone called leptin. Leptin is released into the blood system, goes up into the brain, into an area of the brain called the hypothalamus, and it makes you feel full. And I guess if the stomach isn't producing the right amount of leptin, you don't get full. The other thing that happens is you can become leptin resistant. What does that mean? Well, just like if your pancreas produces too much insulin, the insulin goes into the cells, opens them up like a key and allows sugar in. If you put too much insulin, because you're eating too much sugar, the cells become insulin resistant. They no longer allow the insulin to open them up and allow the sugar in. So now the sugar floats around in the blood, and that's called type 2 diabetes. You can also become leptin resistant. If you just eat too much food, and the stomach produces a lot of leptin over time, the brain says, I don't know if you're telling me the truth or not. I can't listen to you. And so the brain, the hypothalamus, becomes leptin resistant. And so what we have to do then is we have to stop producing so much leptin so that the brain says, where's leptin been? I haven't seen it in a while. Oh, you know what? I'm going to let leptin send messages to the hypothalamus again and tell me that you're full. But I know when I'm ravenous and I can't stop eating, I pull the stomach away from the diaphragm. My doctors do, you can't do it yourself. And within minutes, I start to feel comfortable again. So just something to consider as well. And that's something I've struggled with in my personal life. I know a lot of you do because I see you as patients. So a lot of people come in and say, Doc, I'm eating so much less and I'm feeling so much better because I'm on the Super Greens, I'm on the Essential Source, I'm taking the adrenal support because we're going to talk about cortisol. The adrenal support is helping the adrenals produce the normal amounts of hormones and cortisol. And Doc, it's just an overall package. And then pain. Pain is a big issue. How many people have pain? Raise your hands. A lot of you. I know you do because I see you in my offices. And pain, we talked about earlier, produces cortisol, and cortisol causes you to be hungry. It's a hormone that causes you to be hungry. And so many times when patients come in for chiropractic care or pain management to our offices, we are able to manage their pain, get to the cause of the pain, and then they're not as hungry, which is kind of cool because you stop producing the cortisol because you're not under stress anymore. And if you have an issue, by the way, I always mean to say this in the shows, I always forget about it. I have a little sticky note on my dashboard, I forget. If you have an x-ray or an MRI, you want us to read it with you and go over it with you, just call the office. We're more than happy to go over it with you and give you a second or maybe a third opinion. We have five doctors in our office now, and we have 5 different eyes looking at it, 5 different expertises. Is that a word? And we can give you some ideas as to what's going on, because many times, like the thyroid, it's normal. Well, let's dig a little deeper. Look at the x-ray. The x-ray, one doctor says it's normal. We look at it and say, oh my gosh, this bone's out of place. You have arthritis here. You're crushing that nerve there. There's a twist. The hips aren't level. Oh yeah, you're right. I didn't see that with the other doctor. So we're more than happy to meet with you and discuss your issues because we want to get you well and keep you well. And you do that by having a normally functioning nervous system, a normally functioning digestive system, and good nutrition. That's why we have the supplements. I make the supplements because it's easy and it's inexpensive and it's powerful. When you start giving people nutrients that the body's craving, it's insane how well the body does with it. All right, let's keep talking. We're talking about other reasons why you might not be able to lose weight, even though you're doing the right thing. When it comes to carbohydrates, you got to be careful. Because carbohydrates, we said sugar, if it's in the form of glucose, is utilized as a fuel. in the cells. Once the cells can't take any more fuel, the sugars are converted into glycogen, where it's stored in the liver, and then glycogen is converted into triglycerides, which is then stored as fat. And so triglycerides, if you do a cholesterol panel, it usually shows up on there. And about 1 in 100 people have genetically high cholesterol. 99 out of 100 respond extremely well, statistically, to getting the diet straightened out, getting the digestive system working, getting the nervous system working. And that's exciting. And that's why a lot of doctors, in fact, I won't say the hospital yet, we haven't signed a contract yet, but a hospital near in the area where I practice, in the Atlanta area, they asked me if I would come and set up a clinic in the hospital. Now that's unheard of. You know, chiropractors and nutritionists working in a medical facility, and a lot of doctors there are big fans, which is kind of cool too. So if you're at that hospital, you know who you are. Nice to have met you the other day, by the way. And it's really cool because the healthcare pendulum is swinging in a different direction now. I don't want to say back, it's swinging a totally different direction because they're saying, all right, we have people with pain management. And medical doctors, primary docs, send them to the pain docs. The pain docs can only prescribe so many opioids or so many drugs because they're being monitored. Every time they write a prescription, it goes into some database in the sky, and the federal government is looking and saying, this person is prescribing a lot more opioids or drugs than the average doctor. Let's go knock on his door and find out why. Sometimes it's legitimate. But one of the things that the government wants us to do is you have to get these people to alternative healthcare treatments aside from just drugs. And this is where chiropractic and nutrition come. We're here. We're the knights in shining armor. We are the alternative. And then we can document, yes, they sent Bob to us. We gave him the opioids. We sent him to chiropractic care. We gave him a nutrition evaluation. We put him on a weight loss protocol. And then if maybe there's a case where you still need the opioids, then you can document, yes, this person still needs them. But if you haven't exhausted all your efforts to try to get the patient well, the doctor's now being scrutinized. And they're scared because they could lose their license or worse, go to jail. And so doctors are getting real nervous about this, and that's why you're starting to see the trend toward more chiropractic, more nutrition, more weight loss. In fact, at our office, we do a doctor-supervised weight loss program where we work with you. It's usually about 14 days. We kind of prep you for a couple of days. We get you on this protocol where you're taking supplements and shakes and eating. We're not going to starve you. And then what that does is it resets the body. It resets the brain, the hypothalamus, and then we can help you get into the next phase. So if you're serious about wanting to do a doctor-supervised weight loss program, my team of doctors and my staff are more than happy to help you. Just go to drjoe.com. You can call the office, and we'll be more than happy to talk to you about what we can do as far as that goes. And doctors as well. If you're listening and you have patients, please feel free to send them to us, and we'll co-manage your cases with you. So we talked about sugar and carbs because the carbs turn into fat. So now you're hearing me say, wait a minute, you shouldn't eat a lot of fat because it will make you gain weight. You shouldn't eat a lot of carbs, and you shouldn't eat a lot of protein. Is that what you just heard? That's what I just said. What do? There's nothing left to eat. Can't live on romaine lettuce forever, right? Well, the good news is you need to have all of them. Those are called the macronutrients, carbs, proteins, and fats. But you have to have the right kind. And that's the secret right there. So in a perfect world, you would have about 45 net grams of carbs every day. So what's a net gram? What you do is you take the carbs that you're eating, whatever that carb is, and then you minus the grams of fiber that you're eating. So let's assume I eat something with 20 grams of carbs, but it has 15 grams of fiber in it. That's a net carb of 5. So in a day, in a perfect world, you would have about 45 grams of carbohydrates a day, net carbs. It's tough. How do you get that much fiber? You get it by eating things like fruits, vegetables, nuts, and seeds. You can only get fiber from plants. You can't get fiber from animal products. Animal products, too much protein, stress on the kidneys and the liver. Not a good idea. And the other thing too is if you start going to a high protein diet and you're not giving your body any carbs, the body says, I need some sugar. So after a while, this is what happens with the ketogenic diet. If you're not cycling in and out of it, the liver starts producing glucose through a process called gluconeogenesis. So what happens now, your body starts producing its own sugar because you're not giving it any sugar. So going on a zero carb diet and eating nothing but animal proteins or fats, not a good idea because your liver says, I'm going to start producing sugar on my own through gluconeogenesis, and then that can raise your insulin levels again. Is this confusing? It's confusing, isn't it? So the good news is it's not hard, it's easy once you understand it. So again, we can put you on a doctor-supervised weight loss program at our office, drjoe.com. We can do that, by the way. I know this show goes all over the world. We can do this over the phone if we need to as well. So what do we eat? Well, for breakfast, I like to start out with Super Greens and Essential Source every day. Then I take adrenal support. So I'm going to start talking about adrenals next, and I got to talk about the cortisol before we run out of time. I take adrenal support. I take a B complex. And as a vegan, I don't get B12, a lot of B12. So I take a B12 supplement. And then I'll have some fruit. Maybe I'll have some oatmeal for breakfast and maybe some raisins on there. And then for lunch or dinner, I always have a salad. Now, sometimes if I bought too much, greens, I'll have a salad for breakfast. Oh my gosh, how sacrilegious, salad for breakfast. You can have anything, anytime. So lunch is usually a big salad, and I'll put some nuts in there. I'll make a salad dressing with a little bit of oil, but not a whole lot, because you need some oil to absorb your vitamins A, D, E, and K. Those are fat-soluble vitamins. So no oil is not a good idea. So I'll usually have a big salad, and I'm big on soups, especially in the wintertime. And soups are great because you can do split pea soup, bean soups, lentil soups. And those are great because they're very filling. Now, if you start having digestive issues, like a lot of gas, you can take Dr. Joe's digestive enzymes, because digestive enzymes help break down something called the raffinose, which is a sugar that produces the gas. That's why a lot of times people eat potatoes and get gas, because it's a lot of sugar. They'll eat bread, they'll get gas. So it could be that you just need to help assist the enzymes in your body. And the older you get, the less enzymes you produce. So you can get Dr. Joe's enzyme support. I take enzyme support every time I eat a cooked meal. So if you're doing that for breakfast and lunch, dinner, I'm kind of a little more flexible on that. Now, if I'm really trying to lose weight, I'm going to skip dinner a couple of nights a week. That's called intermittent fasting. And that allows me then to get the body reset again. And many times, you ever have those days where you're just fat and bloated? I get them. We all get them. I just feel blubbery today. Skip dinner. Drink water, of course. Skip dinner. By the next day, many times you're right back where you need to be. So it's really kind of cool. Again, as a chiropractic team, we don't just work on the spine. We work on your diet. We try to teach you these lessons about what to eat. We talk about supplements. And we want to make sure your digestive system is working. So if you have acid reflux, heartburn, burping, gas, bloating, we may have to adjust or pull the stomach down away from the diaphragm. So if you want to make an appointment to come see us, usually around this point in my lectures, people start going, Dr. Joe, I think I need to come see you. I've got the neck pain, the back pain, the headaches, and my husband and my spouse and my boyfriend and my girlfriend, my coworker. Spread the word. Tell them. Every single day in our offices, we get referrals. And I say, how'd you find out about us? We had a police officer the other day, got in a car accident. She goes, my sergeant said I had to come see you. Patients come in. How'd you find out about us? My wife said I had to come see you. My coworker, my friends, my family. So anyone that's suffering, send them to us if they want to get well, and we're more than happy to meet with them. Go to my website, drjoe.com, make an appointment. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. If you want to get the supplements we talk about, they're all on the website as well. We have over 1,000 hours of audio and video podcasts on the website. We have a blog. Follow us on Facebook. Follow us on Instagram. Many times we live stream lectures. Send us your email address. We'll put you on that special private list that we send out specials for, and I'll write articles and do special lectures for that. But I want to be your doctor. We all want, my team of doctors want to be your doctor. So stop suffering. Just go to website, drjoe.com. Most people are very happy that they did. We can't fix everybody, but major majority of people just love the fact that they finally have an answer. And if you have questions, you need a second opinion, we're always there. Again, the website's drjoe.com. So we talked about elevated blood sugar levels and what happens there. Kind of running out of time here. But sleep. We got to talk about sleep. Because you're supposed to sleep, we call it the Goldilocks zone. Some people can do 6, usually 7 to 8 hours a day is perfect. If you sleep too little, you raise your risk of disease. If you sleep too much, there was just an article out, it can raise your risk of heart disease. If you're sleeping more than 10 hours a day, it can increase your risk of getting sick. So you got to kind of hit that Goldilocks zone. But why aren't you sleeping? Many of you, it's pain. I know, I have an old neck injury. I got hit by a car when I was 10 years old, landed on my head. They thought I was dead. And every now and then, if I sleep wrong, twist my head, it acts up right there on the side of my neck on the left side, and I'll wake up. It's usually around 3:14 in the morning. I don't know why that's my magic number. And so I have to go get adjusted, grab one of my doctors and get adjusted, and it helps. But this is a permanent injury there, so I have to stabilize my spine. I have no choice. I have to get chiropractic care, not on a semi-regular basis, maybe twice a month. And I've got to make sure that I'm getting that taken care of. So if pain is an issue and you're not sleeping, come see us, and we're really good at pain management, and pain correction, I should say. Many times you eat too late. You need to eat at least, I would say, 4 hours before you go to bed would be perfect. So you have dinner at 5, go to bed at 9, have dinner at 6, go to bed at 10. Give the body a chance to get the food out of the stomach. Because what happens is when you breathe, your diaphragm drops down and sucks air into your lungs. And as you exhale, the diaphragm pushes up and pushes air out of your lungs. Pretty cool. If your stomach is pushed up against your diaphragm, we talked about that, acid reflux, heartburn, burping, gas, bloating, we may have to move the stomach away from the diaphragm so that the diaphragm can start moving. Because when you're standing up, you have gravity helping you. When you lay down, you don't have gravity. The stomach is up against the diaphragm. You can't breathe. How many people do this or hear this at night? Gasping for air. They stop breathing altogether. Sleep apnea. Many times it's a physical problem, not a chemical problem. And if we can pull the stomach away from the diaphragm and then don't have a lot of food in there late at night, many times that helps you sleep. Stimulants. Got to stay away from the stimulants, folks. Coffee, tea, chocolate. These things are stimulating to the brain and the nervous system, and that could prevent you from sleeping as well. So I find when you eat the right diet, a lot of fruits, vegetables, nuts, and seeds, Dr. Joe's Super Greens, Dr. Joe's Essential Source, B-complex I take in the morning. And then if you're tired all the time, and that's the reason you're not getting good night's sleep, your cycle is off, you might want to consider Dr. Joe's nitric oxide support. Nitric oxide opens up your blood vessels to your brain, to your muscles. And I tried taking it one time at night, I couldn't sleep. So I have to take my nitric oxide in the morning, and it helps all the body, including your, let's keep it clean, reproductive organs. Opens up circulation. And as we get older, our circulation does get less. So it's kind of a neat little trick that a lot of people use. That you're not supposed to use it for that, but it does work for that. And I got to talk about the adrenal glands. The adrenal glands produce energy. They produce adrenaline. They produce pregnenolone. Pregnenolone becomes DHEA, and DHEA becomes either your sex hormones or it becomes cortisol. So when you're under stress, you have the pregnenolone becoming DHEA. DHEA says, if this person is healthy, I'm going to help produce testosterone, estrogen, androgen hormones, and we're going to make this person healthy. If they're under stress, the body says, we can hold off on the reproductive part for a second. Let's produce some cortisol because they're under stress. And cortisol causes you to lay down fat. And then fat, we said, produces estrogen, and estrogen causes you to lay down fat. So we can test your cortisol levels in our offices. And if the cortisol levels are too high, it's supposed to be high in the morning, go down at night. If the cortisol levels stay high all day, then we have to start thinking about what's causing the stress. Is it neck pain, back pain, shoulder pain, numbness, tingling, muscle weakness? That could be a stress, physical. Chemical, we look at your diet. Are you doing coffee? Are you doing alcohol, meat, sugar, dairy, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas? Chemical stress. Is there emotional stress? A lot of times I can't fix the emotional stress, but the physical and the chemical are usually pretty easy. If you're not digesting your food properly, chemical stress, we need to adjust the stomach, adjust the spine, open up the nerves to the organs. And then we can monitor the cortisol levels and watch it turn around and get normal again. And cortisol, like I said, stress hormone, it causes you to lay down fat. From a chiropractic standpoint, we always want to check the nerves. For a woman, it would be like right below the bra strap, the upper lower back or the lower upper back. That's the nerve supply to the adrenals and the kidneys. And my friend who came in the other day, I talked about him earlier, as soon as he says he's got kidney failure, as soon as I pushed there, he came off the table, that hurts. So he had a pinched nerve going to his kidneys. He was eating way too much protein, which is putting a stress on the kidneys. He had his stomach stapled, so the food they told him to eat was high concentrations of protein and protein shakes, not a good idea. So I got him on Super Greens and Essential Source and avocados and smaller, easy to absorb amounts of food with high concentration of nutrients. And I'm sure he's going to do well. Hopefully we can turn it around at stage 4 kidney failure. It's never going to be perfect, but if we can keep what he has working for another 50 years, we scored pretty well. And again, he was overweight. So the obesity led to the stomach. I wouldn't have done it. The stomach, they removed a piece of his stomach. I wouldn't have recommended that approach, but he said, well, I'm desperate and I'm diabetic, and the diabetes was out of control, and now it led to these other problems. So the way to get a healthy plan is to get well and stay well. Normally functioning nervous system, normally functioning digestive system, and good nutrition. It's not hard, folks. It's easy. So if you need a coach, my team of doctors would love to work with you. We'll check the nervous system. We'll check the digestive system. We'll do a nutritional workup on you. Go to my website, drjoe.com, and make an appointment. Stop suffering. Most people are thrilled they are. Bring your friends, bring your family, bring your kids. Kids have spines too, and if they're twisted, we need to get those spines straightened out. And I love it in my office. You see children all day in and out of the office, and the parents they want to hug you and kiss you and name their next kid after you because you help their kids. Nothing's more important than, of course, taking care of your kids. So stop suffering. If you've ever been in a car accident, the car was damaged, you were damaged. I have to say that because I know we have people coming on and off the show. But go to my website, drjoe.com. We want to get you well and keep you well. You can also order the supplements on the website, the Super Greens, the Essential Source, the B-Complex, the vitamin D. Any questions, send them to me through the website, drjoe.com. Folks, I'm Dr. Joe Esposito. Got to run. Thanks for listening. Catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.